Well, thank you for joining us today. I'm joined by, of course, our PC Health Critic, MPP Jeff Yurek, Tara Bork, doctors Nadia Lam, Mark Linder, Jason Profetto, Kulvinder Gill, and Brenna Velker. The Ontario Liberal government continues to make short-sighted decisions affecting our most vulnerable in Ontario. They have cut the healthcare spending, $54 million in 2015, in terms of the transfer that the federal government gave the province. We've seen a $50 million cut in physiotherapy, over $800 million in physician service fees. Meanwhile, over 800,000 people in the province are without a family doctor, and an additional 140,000 new patients are coming into the system each year. All of these cuts have one common denominator. They hurt patients. This is what it's about. It's hurting patients. As I've traveled the province, I have visited hospitals, talked to doctors, talked to patients, whether it is in Ottawa or London or in Windsor. It is a common theme in every community we go to. People are concerned about the diminishment of healthcare in Ontario. We deserve a government that makes patient-centered care a priority. Wait times for life-changing surgeries, doctor appointments, and emergency room visits continue to get longer. People in remote and northern communities are forced to travel longer distances to access the services they need. When I meet with doctors, I hear how cuts are impacting their ability to provide a level of patient care they aspire to. 241 communities in Ontario are designated as having high physician needs, yet the government continues to cut medical residency positions. Other doctors and former colleagues decided to move to other jurisdictions to practice. Just last week or 2 weeks ago, I brought up the point of this happening in Thunder Bay, leaving more Ontarians without a doctor. When I meet with nurses, I hear how nursing colleagues were laid off, how their already hectic patient loads are getting even more hectic. They struggle to keep up, but sadly continue to see further reductions to important face time with those they care for. Mismanagement in healthcare is affecting patients. These cut to frontline services are at a blatant attempt by the governing Liberals to clean up their own fiscal mess. Providing necessary physiotherapy for seniors or physician services in general did not cause our debt or deficit. It was years of scandal, waste, and economic mismanagement. The reality is this Liberal government's record of economic mismanagement has meant less money available for healthcare services Ontarians need. Patients suffer when the money that should be used for healthcare is swallowed by bureaucracy, scandal, and incompetence. And blaming the federal government doesn't wash with the facts. Federal contributions since 2004 have gone up 6% through the Canada Health Transfer. So quite frankly, there is no one left to blame for this epic failure than the Liberal government themselves. Today you will hear from both doctors and patients who have first-hand experiences with the consequences from these ill-conceived cuts. What's important to take from this is not that the Liberals have cut millions here and there, but that patient care in Ontario is suffering. And the only one to blame is the mismanagement of this government, of Health Minister Eric Hoskins and Premier Kathleen Wynne. So on that note, I'm going to ask Jeff Yurek, our health critic, to add a few additional points before we hear from some of our professional representatives here today.
Thanks very much, Patrick, and thank you for coming out today. We're here today with family doctors and a patient who will share their stories from you. And they've come from around the province. They're not just Toronto-based. We have them from Sarnia, from London, Stony Creek, Brampton. So we're glad that they've come to hear their stories. And just to say, healthcare is the provincial government's most responsibility to deliver to people today. Our health and our health of our families are very important to us, and we depend on reliable and timely access to quality care. Unfortunately, this government continues to erode the already fragile system we have in place. This is a government that continues to punish patients and frontline healthcare workers because they're spending the money on Liberal scandal and mismanagement. Our caucus is pleased to put forward an opposition motion today to restore funding to physician services and return the missing federal Canada Health Transfer money back to Ontario's healthcare system. Our Ontario patients deserve better. And I'd like to bring forward a patient, Tara Bork, who will tell her story, followed by Dr. Nadia Lam, Dr. Mark Linder, Dr. Jason Profetto, Dr. Kulvinder Gill, and Dr. Brenna Velker. And each one bring a telling story of how these cuts this Liberal government has imposed on our healthcare system is affecting patient care throughout Ontario. Tara?